Hey everyone, today we are jumping into a topic that is absolutely critical for your nursing practice, and you guessed it, a huge deal on the NCLEX, Advanced Directives and Living Wills. We're going to break it all down in this study guide, so let's get right to it. So let's just imagine for a second. Your patient is unresponsive. Their condition is going downhill fast, and a huge decision needs to be made, like right now. Who gets to make that call? This is not some textbook question. This is real life, and it happens every single day. The answer? It's all about understanding advanced directives. So here's our game plan. We're going to tackle this just like the best study session ever. We'll start with the basics, what these things even are. Then we'll compare the key documents you've got to know. We'll zero in on your role as the nurse, and then we'll get into the messy stuff, applying it all to tough situations. And to wrap it up, we've got some quick memory tricks and a final challenge to really get your clinical judgment firing on all cylinders. Okay, first things first. We have to build a solid foundation. You've got to master these basics because that's the only way you're going to nail those tricky application questions later on. So, an advanced directive, what is it? I want you to think of it as a big umbrella term. It's basically a legal tool that lets a person keep their voice even when they can no longer speak for themselves. It's their way of saying, here's what I want for my future medical care while they still can. And why do these matter so much? Well, they're not just pieces of paper. They preserve a patient's right to choose for themselves, their autonomy. They stop treatments from happening that the patient never wanted. In a crisis, they become a roadmap for the family and for us, the healthcare team. And honestly, they can prevent so much conflict and heartache down the line. Okay, if you're going to tattoo one phrase on your brain from this, make it this one: self-determination. Seriously, you're going to see this on the NCLEX. It's the core ethical principle here. And if you can spot it, you can probably spot the right answer. Now, tucked under that big advanced directive umbrella is a very specific document, the living will. This one is not about picking a person to make decisions. Nope. This is all about naming specific treatments. We're talking CPR, feeding tubes, mechanical ventilation that a person either wants or doesn't want at the end of their life. Now listen up, because this is a huge point. A living will is basically inactive, just sitting on the sidelines for as long as the patient can make their own decisions. It only gets activated, it only comes into play the second they lose that capacity. This trips a lot of people up, so it's a favorite for test questions. Okay, you've got the basics down. Now let's move into an area that the NCLEX absolutely loves to test. Can you tell the difference between all these documents? Let's break it down. So let's look at this chart. The living will, like we said, lists treatments. The durable power of attorney for healthcare, or DPOHC, that one names a person. See the difference? Both of them kick in when the patient is incapacitated. Now, a DNR, or DNI, that's different. It's an actual medical order in the chart. And a POLST? Think of that as a set of doctor's orders that can travel with a seriously ill patient. Knowing what each one does and when it's used, that's the key. And here it is, the #1 NCLEX trap, mixing up a living will and a DPOA-HC. But it's actually super simple when you boil it down. Living will is about things, specific treatments. A DPOA is about a who, a specific person. One's a wish list, the other is a spokesperson. Burn that difference into your memory. All right, let's shift gears. This next part is probably the most important for you as a future nurse, and for sure the most heavily tested. What is your job in all of this? What do you absolutely have to do? Your responsibilities really boil down to 3 key actions. 1, you assess. When that patient comes in, you have to ask, do you have an advanced directive? 2, you implement. You get a copy of that document, you make sure it's in the chart, and you make sure the whole team knows about it. And 3, and this is the big one, you advocate. You are the patient's protector. If you see care happening that goes against their wishes, you have to speak up. And here's a straight-up pro tip for your exam. When you're staring at a question about this stuff, look for an answer choice that sounds like this. This phrase is gold because it combines 2 critical nursing actions, communicating with the provider and standing up for the patient's wishes. Okay, so you know the facts, but the NCLEX isn't about just spitting back definitions, right? It's about taking what you know and using it in those messy, complicated, real-world situations. So let's practice. The very first question you have to ask yourself in any of these situations is this: does my patient have decision-making capacity? And that doesn't just mean, are they awake? It's these 4 things. Do they understand what's going on? Do they get what could happen based on their choice? Can they weigh the pros and cons, and can they tell you what they've decided? That's your first assessment, always. And this right here, this is the golden rule. If the patient has capacity, what they say to you right now, in this moment, trumps anything they wrote down 5 years ago. Their current voice is the only one that counts. But if they lack capacity, then and only then do you turn to the advanced directive or that designated decision maker. Okay, here's the classic scenario. You've seen it in textbooks and you'll see it on the test. The family is at the bedside, they're upset, and they're demanding you do everything to save their loved one. But the patient has a valid living will that clearly says no CPR. So what do? The answer is clear and it is non-negotiable. You follow the patient's documented wishes. Your primary duty always is to the patient, not the family. All right, let's do a quick rapid-fire review to really hammer these core concepts home. Think of these as your mental flashcards for exam day. Ready? Living will? What is it? It's a written document. It's about specific treatments. It applies only when the patient is incapacitated, and it's focused on the end of life. Got it? Refusal of care. It's a legal right. It's an ethical principle. It requires that the patient has capacity, and you, the nurse, absolutely must honor it. Simple as that. And what about your role? 4 key actions: assess, verify, advocate, and communicate. That's your job in a nutshell. All right, time for the final challenge. Let's put all the pieces together and see how your clinical judgment holds up. Okay, read this one carefully. You have a valid living will. It specifically refuses mechanical ventilation. The patient is now unresponsive. The family is at the bedside, and they want you to intubate. What's your move? What's the right thing to do right now? The correct answer? You follow the living will. You have to. This scenario is the ultimate test of that core principle. The patient's legally documented wishes win over the family's requests. Your job is to honor that wish and make sure the whole team is on the same page. And we'll end with this one, a real toughie to get you thinking. The living will says no feeding tube, but the patient, whose ability to make decisions is kind of coming and going, they're now verbally asking for a feeding tube. What is your priority? What is the very first thing you need to do? Ponder that one, because that is exactly the kind of complex thinking you'll need on the job and for the NCLEX.